Welcome, welcome. I am so excited about today's guest. Hi, and a warm welcome to the Think Differently by Design listening tour, hosted by Dina Redinger and Sharon Weinstein, co-authors of the book Think Differently: 18 Strategies to Fix Broken Thinking. We invite you to engage with your peers and us as we address issues related to nurses, nursing, and the workforce. In our studies of women in particular in leadership positions, we have found that success happens when we ask the right questions and solve the right problems. Our respective healthcare careers and writing careers make us uniquely qualified for this role as facilitators. We invite you to be a part of the program by participating in a 30-minute discussion on LinkedIn Live with us. Let us know if you'd like to be interviewed. We conduct these live interviews on Tuesdays and Thursdays and will continue through the end of February. And our goal is to provide nurse leaders with an opportunity to be heard, to express their opinions, to share their ideas, and to tell their stories. But before we start, I want to recognize our viewers from across the globe. Use the chat, let us know where you're from, what country you're in, even what time zone you're in. And if you're seeing this on replay, you can still comment and we will respond. Today, we welcome Dr. Alexis Hanson. She is the MSN Academic Chair for the School of Nursing at Purdue University Global. Alexis earned her Bachelor of Science at Barry University in Miami Shores, Florida, her Master of Science in Nurse Anesthesia from Wolford College in Naples, Florida, and her Doctor of Nursing Practice and Family Nurse Practitioner from the University of Arizona, Tucson, Arizona. Do you see a theme here? We're talking Florida, Arizona, good weather. This is a woman who likes her weather. Dr. Hanson is a board-certified family nurse practitioner practicing in the areas of urgent care, integrative health, wellness, and aesthetics. She has over 20 years of combined experience in her areas of specialty, including critical care, which is where she started out, and I love it because I did too, anesthesia, cardiac clinic, family and urgent care, management, administration, leadership, and academia. Her research areas include diabetes, health and wellness, obesity, and education. And she loves teaching, learning, and collaborative practice environments, all geared toward helping us others achieve their goals and dreams. I'm going to turn it over to Dina. What question do you have for Alexis this morning?
First off, again, thank you so much for being with us. We're honored to have you with us. And some of those things that you love, these teaching and working collaboratively, really does, bring a lot of synergy for all of us, for Sharon and I. And so the first question for you is, how can nurse practitioners help eliminate health disparities?
Oh, thank you so much, Dina. And thank you both, Dina and Sharon, for inviting me to be here today to share. So there are many ways that nurse practitioners, also called NPs, can help in eliminating health disparities because, our goal is to improve patient outcomes. I believe the pathway to meet these goals includes having a proactive approach in creating that positive relationship of the patient and provider, building that trust.
Mhm.
It You have to have effective communication, you have to have effective collaboration, and not only collaborating with other nurse practitioners, with nurses, with other healthcare providers. The patient is a member of the team, their family, the caregivers, the community. Um, I do just want to go do a little bit of background. Growing up, I was that kid that always wanted to help people in any way that I could. My father was a type 1 diabetic. And actually, one of my earliest memories was learning how to give my dad his insulin shots. Um,
Wow.
yeah,
How old were you? How old were you?
I want to say I was 5.
Oh my goodness.
Yeah, because
Five
they
with a
never,
needle in hand. Oh my.
yeah, they showed me how to do it. And I never had that fear. I never had that fear of needles. It was so normal in our household. My dad got diabetes at age 13. So, yeah, it was just a really neat experience. And so our family, I was an only child. Our family focused on, health, wellness, exercise, how to best manage my father's disease. But our team was my mom, my dad, and the healthcare providers. And once again, this is just one of the many reasons I became a nurse. But first, I was a nursing assistant, which I felt was very important. Is I was a nursing assistant, and then a nurse, and then I became a nurse practitioner. Um, Also, another really strong piece is working in intensive care and in family practice. I worked a lot in underserved communities while being in academia. So I've taken care of many patients that had developed complications from a disease process or health issue that really honestly could have been prevented if that patient would have had the appropriate resources and support to better manage their health. So it's important as nurse practitioners that we're, those patient advocates, advocating for their rights,
Oh, yeah.
advocating for their care. We focus, of course, on the physical assessment and the exams and the diagnosing and treating, but we also focus strongly on patient education. This is whether you're a nurse or a nurse practitioner, and that includes health promotion, disease prevention. And if a patient comes into a healthcare facility with a chronic disease, I feel that NPs, nurse practitioners, treat the whole person. Not that the whole team doesn't, but we're looking at the mental aspects, the physical aspects, the emotional aspects. And in order to eliminate health disparities, we need to remember also that each patient is unique. You may have 5 people with diabetes, but none of them are the same. They have different comorbidities. They have different family situations. They have, different areas that they live in. So it just is, it's a mixture of what goes into that patient's care. It's important as nurse practitioners that we're great listeners because the patient's going to tell us their concerns. They're going to share with us their challenges. And many times when I have a patient that shares a challenge with me, I'll say, but what have you accomplished? Where are your triumphs? Well, before I couldn't kneel down and play with my grandson. And now I can and actually get up off the floor.
That's a win.
Holding on to something. So it's the little things. It's important that we have that communicative, the collaborative relationship in order to build, once again, for that recovery. I feel very lucky to have had and to have worked in many different areas. And the other thing that I think is very important when we look at healthcare, disparities is it's not only the shortage, in nursing, of nursing care, of nurse practitioners, of physicians, but it's also, making sure what that patient needs and providing those services or know where to get those services. And also for that patient to feel comfortable sharing their situation, building that trusting relationship. And honestly, that can take a while with some patients.
Right. I want to pick up on something that you said.
Yes.
And actually, it's also a combination of that plus something from one of our viewers.
Sure.
A colleague from LA says, how did you get into academia? My question to build on that would be, you are so passionate about practice. When you talk about patient issues, for example, the comorbidities, they're not going to have only one. They may have 2, 3, 4. It could be heart, it could be kidney, it could be anything.
Right. Right.
When you're so passionate about clinical practice, how did you get into academia?
Okay. Why I got into academia is from the start, within 6 months of being a nurse, I went and I worked right in critical care. And
Of course, you were 10 years old then, right?
I was 10. Yeah, no, I'll own it. I'm 55 now. I'm getting there. But I was a non-traditional student and didn't start my career till like 29.
Oh, okay.
So I think I brought in, that maturity. But why I wanted to is I found that I was teaching in clinic. So they would have me teach the courses. We had new residents. I was at a level 1 trauma. But what I wanted to do is I was so passionate about the care and the things to look for is I wanted to share that knowledge. And actually, it was after I had gotten my anesthesia degree and I saw a critical care position. And I thought I had been teaching in a ground university. And I thought, well, it's critical care. I've been doing it for a while. I'd interview. And I did, and I got it. And the course I was teaching was critical care. I also had students in clinic. And so that's where I found my passion is I wanted to share what I was seeing that, the book goes so far, right? Then it's common sense. Then it's
Mhm.
collaboration. Then it's the communication. Then it's things that you may not necessarily learn everything from a book.
Mhm.
Right.
Is that if you can share that passion and they know that you truly care about what you're doing and what you believe, they want to do that too.
Mhm.
They all have their areas of specialty that they want to go in. So
Right.
that's
Yeah.
what got me into it.
But I want to go
I
back
thought
to
that.
the
Go
word
ahead,
too
Dina. Go ahead.
before you start sharing, and it keeps coming up over and over again. Is
Mm-hmm.
that there's got to have trust. You have to build trust in people for you and your knowledge, but also build trust in them that they feel comfortable enough to share with you what's really going on. So I
Right.
think that's such an important skill. Like you said,
Right.
it's not in a book, and you can't teach it. So I wanted to say kudos to you because I'm taking notes. It still comes back to trust and building that trusting relationship with people. So thank you.
Oh, it does. Absolutely. There's one thing I wanted to add on that because, students are like, well, what if it's a really angry patient? What if it's a frustrated patient? And we all have those. And I had this one patient that he had gone through 5 providers. I was his 6th. And he'd come in and we did the assessment. And I knew he took his meds. He'd go for refills and nobody really wanted to work with this gentleman. And he came in, he was very respectful, did his assessment. And I said, okay, I'm going to see you back in 2 weeks. I remember clearly we started him on a new blood pressure medicine. He's like, I'm not coming back. I said, oh, that's okay. I'll see you in 2 weeks. He's like, but what if I don't want to come back? I said, that's okay. I said, I'll see you in 2 weeks. He's like, maybe. I said, all right. And 2 weeks he was back because I didn't let it shake me. And he
Right.
came back. He said, I only came back because I wanted to see how else you could help me. Okay. And we do it again. And that was our same conversation throughout the 3 years I took care
Yeah.
of him until he moved.
Yeah.
He moved
Yeah.
to a different state.
You
But
built
That's
trust
great.
though because you kept trusting. You just kept taking him down this road of, I'm still going to be here, and you can't run me
right.
off. Right.
Mhm.
That's
If you
so
show up,
huge.
it'll be great.
Right. So back
Right.
to you, Sharon. I didn't mean to cut you off, but it was such a powerful
No,
piece,
it's
and I
okay.
just want to just highlight it because it's just so important. So thank you.
No, it is. Trust is a commodity, and certainly we are the most trusted profession.
We
So
are.
Susan in Houston wants to know, you're wearing multiple hats. Are you also a CRNA?
So I am no longer practicing anesthesia actively. So I haven't done anesthesia for probably, oh my goodness, I bet 10 years. And I do want to preface this, is I loved the education for anesthesia. So it took me through every body system,
Right.
so in depth. I'm grateful for that. I believe that made me another provider. What I missed, and this is just me, is I missed that conversation with my
Mm.
patients. I didn't just like putting him to sleep and waking him up and me having 2 or 3 minutes. Now, some people are amazing with that. It isn't that I couldn't do that. And it isn't that I mean, I managed very complicated cases, but I wanted to know what if and what happens next.
Mm-hmm.
So that's why I went back and got my doctorate in family practice and then went into teaching. So I do still practice. I practice 1 day a week, and as a family provider in the areas that you shared. And then I teach and I love it, and I love being chair because we also do a lot for the students. So it's the best
That's
of both
great.
worlds. I feel grateful.
It was interesting to me because I started in a 3-year diploma program that also had a School of Anesthesia. So it was Pennsylvania
Wow.
Hospital School of Nursing and the School of Anesthesia run by the late Mario Tronsoliti. Most of the folks who went into the nurse anesthesia school went into that school because they knew they could earn more money than they could as a nurse.
Hmm.
And most of them, because we also had a men's school, were from the men's school of nursing. So they had been medics in the military. They
Hmm.
came back into the program and they went and became nurse anesthetists. And
Right.
many of them are still practicing. So it's a
Right.
great area. And when I started
It
in IV
is.
therapy, I was educated by anesthesiologists for
Yeah.
6 weeks straight. It was great. So I have a question for you. And the
Yeah.
question is about burnout.
Okay.
Burnout is such a huge issue in practice and in academia.
Yeah.
And working in healthcare can be busy, it can be stressful to nurses, to NPs, to all
Right.
kinds of members of the healthcare team. There's no question. So, as a nurse leader, can you share some of the strategies that have been successful for you and your
Mhm.
colleagues, your students, as you approach this whole concept of stress, managing stress, and incorporating self care? Because I know you're into wellness.
Oh, I absolutely am. This is a great question too, because in 2021, in the midst of the COVID pandemic, I was actually invited to do a blog article for Purdue, and it was about stress management for healthcare workers. But I look at it as it's really stress management for any of us. It's for caregivers. It's for anyone professional. It's for anyone in life. So there are some really big things I think are important, and once again, it's the health and sleep. I can say as nurses, we're probably our own worst patient because we don't always practice what we preach, but I am getting better. And I will own that with my self-care. If not, I have people remind me. So
You're 4:30 a.m. Okay, go ahead.
That was me. That was me. I don't practice what I preach.
Exactly. So everyone experiences stress. It typically comes from work or life circumstances. It can be a heavy workload. It can be long hours, unclear expectations. It can be due to a conflict in your life. I mean, personal problems. It could be an illness, a divorce, a job loss, and also, actually, a lot of studies I found had shown that time management and procrastination are two really big causes of stress. But the thing is, when you have a lot of stress, that can lead to health problems. Because what do we do when we're stressed? And also, we have our hormones up, right? We have our
Right.
adrenaline up.
Cortisol levels. Yep.
And so when we're going through that, it's we can't sleep. We're grabbing things on the go. We aren't eating healthy. We aren't even taking those 5 minutes. And I know a lot of our students and a lot of us out there, we're managing, and especially our students, we're managing school, we're managing work, we're managing our families. We have a lot on our plates. And once again, it can lead to headache, difficulty sleeping, upset stomach. And, some people lose weight, some people gain weight. There's different ways that I found, and this was from talking to a multitude of people. I think I shared before we opened up the call that my niece is a new nurse. So and she is working in critical care. So I got to admit, I consulted with her on some of these items too. But even taking that 5 or 10 minutes away when you're feeling stressed during the day, whether you're at work or at home, take that 5 or 10 minute walk. Take a step away where you're turning off your phone, where you're, whether that is going into a bathroom stall or whether that is finding that time away in the break room, or, people who have a lot of families and a lot of, commotion going around the house. Maybe that's just stepping outside and sitting in a chair. There's things like yoga, there's meditation. And I think a lot of people think, well, eating healthy and lifestyle habits are really challenging for me to do. And I think because we have to go, we want that quick fix, right? We're ready to go. We want that 1-100. We want that if we've got that 20 pounds to lose, we've got to do it by tomorrow because we have an event or in a week.
That's right.
But it's about lifestyle changes and doing little things. Like I bring snacks in the car. I always have snacks in the car that are healthier, because sometimes that is, my downtime. Or at home, even making pre-prepared meals, or finding that that workout. I mean, I'll say one of the workout contraptions, I won't say which one, and it's 20 minutes a day. So it's 20 minutes a day and it makes me feel better. Or in the middle of the day, turn on some music and dance in front of your screen. Just make sure the camera's not on. Do you know what I mean? Unless you want to share that. Right. But it's little things. It's little things that we can do to de-stress, and things that are just for us. And there's things we can do together as a couple or as a family to de-stress. So, and also respecting one another's time and saying no to some things. That's a really challenging thing.
No is a complete sentence, isn't it? In my mind, the more no's you give, the more yeses you can accept.
Right.
When you look at it that way. I heard that from a colleague in Germany. Mickey made a good point. She said, if we're not caring for ourselves and setting boundaries,
Right.
Nothing will
Mhm.
happen. And we absolutely know that we can't drink from an empty cup. It doesn't work that way.
No, we can't.
No.
Uh-uh.
Okay, so here's the magical question, right?
Okay.
What for all those people out there that say, I don't have 5 minutes, what would you say to them?
Okay. I used to be one of those people.
Mhm.
From morning till night. If they don't have 5 minutes, find it. So it's I hate to say that, but I used to write down, and honestly, if you write it down, the more senses you use, like I wrote down my goals and mine started out being 5 minutes. If they see I don't have 5 minutes, what if you woke up 5 minutes earlier? So where can I make that 5 minutes happen? If I don't have time from morning till night, where can I find that 5 minutes? So it's little steps. It's I'm going to get up 5 minutes earlier, or when everyone's asleep in the house.
Mhm.
Tonight I'm going to be 10 minutes later, but I'm going to do something for me. I
Right.
have a very good friend of mine with little ones, and she actually, after everyone goes to bed, she says, I kind of shut the bathroom door. She said, I hop in a nice tub, and that's like my 10 minutes. She said,
Mhm.
that's my 15 minutes. So we can find it, I think, if we want to, but start with little goals, going to your bigger goals, and write them down.
Right.
I even used to write them on my mirror
Oh, I
to
love
remind
that.
me, and that was
Interesting.
kind of a wake-up call, like, "Okay, it's staring at me when I'm getting ready. I didn't do this." So it's kind of where I'm accountable to me,
Yes.
and you
Yeah.
can be
It goes
accountable.
back to making that decision, right?
Yeah.
And deciding,
Right.
am I worth it or not? Because people were so busy sometimes that our self worth,
Yeah.
we are worth it. We can do that. But it's a decision you have to make.
You have to make it. I
Absolutely.
block the time on my calendar. I just block it out.
Yep. And
And
that's a
even
great
on
way
Calendly,
too.
I take it away. It's not there. The time is not there, and therefore it's my time.
Yeah,
Absolutely. That
I
is a
love
great
that.
way too.
I
I've
love
done
that.
that before.
Yeah.
I love
Love
that.
that.
Okay.
So
Go
so
ahead.
moving on, today's leaders need to be approachable. They need
Right.
to listen with intention. Can you
Right.
share with us some methods that you have used to create a supportive, collaborative environment in both the workplace and at the university?
Absolutely. And both are
Meaning clinical and academia. Yeah.
absolutely, and both are equally important, and both are have top importance. Um, I believe to have effective and a collaborative environment in the workplace, it includes effective communication, being open to change and new ideas. Once again, how do you become approachable? How do people know that you're approachable? You're approachable by putting it out there that you are.
Hmm.
Sometimes people don't know until you tell them that if you ever have any questions or concerns, please contact me. And when they contact you, to be welcoming and say, thank you for contacting me about that. And maybe it's
Mhm.
brainstorming on an idea. I never want anyone to think, oh, well, maybe she's too busy. I say, no, I'm never too busy for you. Let's just set aside some time where I can give you my full attention and we can talk about things. Providing constructive feedback. But honestly, I ask my team, do you have constructive feedback for me?
Right.
You know,
Oh,
Mhm.
is there something that I can do better? Is there
Mhm.
something that I can do to
Yep.
help support you better?
Mhm.
I have to say we have because I love our students and I love our faculty and I feel that we are all proactive and positive and we are encouraging and supportive. But once again, it's putting that out there. For
Mhm.
students, we have live seminar. I think that's somewhat different from a lot of universities. It isn't that online programs don't, but we have one every week. Students are in their course for 10 weeks. Every week they have a live seminar where they're interacting with their professor. They're able to ask questions. They're able to be in a safe environment to say, "Oh, I don't understand this," or when I would teach courses I've taught online, of course, and in traditional, I'm like, ask any question. Nothing's a bad question. Nothing's a as people say,
Mhm.
oh, I have a stupid question. I say no question is
there are
stupid.
no stupid questions.
We're gonna learn from it. And so I think that's great. And for people to understand that you truly care, saying, what are your goals? One student's goals or one faculty's goals is going to be different from another and to really get to know them. I mean, our
Mhm.
clinical courses, it's a small group. And even our didactic courses, it's a smaller group than I think to being, on the ground sometime. And it's really building those pieces. Also, some students say, you know what, just tell me what to do, and I'll do it, and I'm good. I don't need any extra time. But some students really need your time, and those are very important students. Is to make what's your challenging now, and meet a student where they are, meet a faculty where they are, meet your team where they are, because everyone's dealing with different circumstances. Usually, sometimes what comes across in a mood isn't necessarily what they're truly feeling.
Right.
I've had many instances where, and I've met with students personally, if they're going through something, or even just to say hello, say, hey, can I brainstorm with you? Absolutely, my door's always open. We had a student who didn't share what she was going through, and she was just angry, and that's okay. She was angry, but she lost someone very close to her. They passed away. And she didn't share that. And I said, is there something else going on with you? And then it came out.
Oh my heavens.
I said, it's okay to tell me because it stays here with me.
Yeah.
And she's like, oh my gosh. And she vented, and she's like, and I'm so sorry for being so angry at anyone. I said, you know what? It's an angering thing. And you were venting your frustrations. And because it came out another way, that's okay. But let's talk about this.
Yeah.
Let's see how we can best help you.
Yeah. If you don't talk about it, it just festers and it builds up, and it builds such anxiety and uncertainty about the future, and more animosity, more stress,
Absolutely,
more breakdown.
If everybody could just take that one pearl away, and you said it very well, is that on the other side of a stressful situation, a bad behavior, an emotion, there's a big need. And I think if everybody could just step back and ask yourself, there's something beyond what we see, there's a need on the other side. And if leaders could step back and ask people, what do they need? What do they want to feel successful? What do you need or want from me to make sure that I'm meeting your expectations?
Yes.
It brings that, once again, that fabric of trust, because if you don't have trust in that relationship, no one's going to, share. But I think it's really important that if people could just step back, and for all the things that unnerve us or make us wonder what's really going on, that truly there's probably a need on the other side, and to be more compassionate. And I know we had Christy Dempsey not too long ago. That was her big, the compassion connection.
Exactly.
Right. Very big importance. So, and I see that. So you shared that with us. So thank you. Nikki said too, your dedication to patients and patient care is truly inspiring. So yes, I truly agree, Nikki.
Thank you. Yeah,
it's very clear.
It's been wonderful when you can actually work in a positive, collaborative environment, and also to have that relationship, like I said, with students, with faculty, with the team, no matter what profession you're in. And so, my hope is that everyone does, take that away and realize they can ask those questions. And if they're open to the conversation, and they, like you said, they approach it with compassion, they approach it with empathy, they approach it with care. A lot of challenging situations, honestly, can get resolved.
Yes. And I think that's why we had so much crime, across the world, is that people have something that they need and that they want to share, and don't feel that they can do it any other way than through, violence or, bad behavior. But that compassion is so evident with what you're working in your work. So thank you so much for sharing your time with us.
Thank you so much.
This has been such an engaging conversation. I could sit and ask you questions all day long. Unfortunately, we don't have that kind of time.
That's okay.
This has been great. It is time for a close and an invitation for our listeners to join us. I guess it's next week, Tuesday and Thursday, and then the following couple of weeks as we welcome your peers to the program. And again, if you'd like to participate, please reach out to us. Alexis, you have been outstanding. It has been such a joy to chat with you. You have really given us some food for thought.
Oh, thank you.
And allowed
thank you, Sharon
folks to start to think about what the issues really are and how they can, in fact, contribute.
Yes, and everybody has to take 5 minutes.
5 minutes.
5 minutes. 5 minutes, and they need to trust the process.
Right. Exactly.
Okay. Strong takeaway. Thank you again. Thank you for being with us.
Thank you.
Thanks, everybody.
Have a great
Okay.
And from Jerica, a great conversation.
Yes. Very good. I love it.